Don't mind starting?
Sure. I'm Jamie Van Leeuwen. I am the CEO and the founder of the Global Living Center.
So my name is Jean Gadi Marius. I come from Haiti. I have I'm working as a program manager for a local organization in Haiti called OSAPO. Thank you for having me.
I'm Arsène Brice Bado. I came from Burkina Faso, but I work in Côte d'Ivoire in Abidjan. I'm the deputy director of the Institute for the Dignity and Human Rights, Abidjan.
I'm Sayla Howell. I am a general surgeon. I'm on faculty at Creighton. I work in the Office of Medical Education and I do breast cancer surgery. Very interested in global health and global surgery. I've been to Kenya and worked with Steve James at Kenya. Had a wonderful experience. Want to go back. I'm passionate about global surgery, not just global health. It's estimated that the global health needs are about 30% surgical in nature. There are people who about 30% of the need can be ameliorated by surgery. I'm passionate about that.
Big James, I would echo what you said. That focus. Well, what we put in, so let's just say one surgery, one total replacement costs a fortune. For that same amount of money, care for 100 people. So that's worth your time and energy. Changes so many more lives.
When I was 16 years old, I wrote a letter to, I don't remember who, it was a nun who was working in global health, and I said, I know this is what I want to do. Tell me what I should do next. She said, I got this really nice letter back. I have it somewhere. Stay in school. You have nothing to offer right now. When you have something to offer, write me back. So 40 years later, I did.
I work on conflict resolution, conflict analysis, not directly health issues, and that's my desire to serve the global community. Deepen with my awareness of human dignity. In war, I work in a country like Sierra Leone, Liberia, Cote d'Ivoire during the war. So for me, working with people who were suffering really helped me to see, to discover the dignity behind their suffering. And when I went for graduate studies in other countries in Africa, in Cameroon, Congo, in France, Canada, still working with refugees, I've seen that these people are sharing the same experience. And for me, there was a kind of a call to serve the human dignity. I mean, to help to restore this kind of human dignity that has been disfigured for several friends. This is how I came to serve.
My passion for it's linked with my story, where I came from. First of all, I raised in a family. I never met my father. I single mother. I have brothers and sisters. And I experimented all kind of discrimination in my life because I had to stay in the street for 2 years. Slept in the street, begging in the street. And I even share the same mattresses in the street with some street men who had tuberculosis at the time. And for some reason in life, I could get my education through. I think I'm so fortunate in my life because I had the opportunity to study in one of the best universities in the world. Despite that, I'm a kid born on the street, the son of a peasant. My mom, she doesn't know how to read and write. As I said yesterday, she got pregnant 5 times in her life. And she never seen a doctor in 5 times pregnancy. So the fact that I had the chance and travel, I graduated med school in Dominican Republic. And then I gained scholarship. I went to Germany, spent a couple of years. I did degrees in international health, and I had opportunity to travel in Africa and different countries in Africa. So that's gives me another point of view. I mean, see how many kids, especially in Africa and Central America, who has the same, live the same situation that I faced when I was kids. And that's really motivated me after 17 abroad and come back, not working in my country, but using myself as a model for the other kids in the world. I mean, telling them, it doesn't matter where you come from, color you are, but if you dream and you fight for your dream, so you can get your goal. And I've been involved and so in love with global health. And other things and I think the global health is really the subject that we need, the science that we need, because it's provide all the basic tools we need to make a change in the world. This is what I'm in love with. That's why I'm.
It's a great comment. I'm going to take a little different take on it. I've done both. I've done a lot of my work domestically. I spent about 15 years working with street populations and homeless in the United States. And then I started doing a lot with East Africa and Uganda and Rwanda as we developed our research institute over there. And I get asked all the time, actually, when I'm in Denver, why would you do global stuff when we've got so much need in our own community? And it's a common question that we kind of people will confront folks with. And from my take, it's that piece of, you look at what people are doing here, there's not really any good place to be hungry. Denver's not a good place to be hungry, and Uganda's not a good place to be hungry. There's not really a good place to be poor, and there's not really a good place to not have access to health care or medical services or basic needs. And so for you all, in the true spirit of the Jesuit tradition, wherever you want to do your work and wherever you sink wherever you find your passion, go do it there. So I think the whole notion of global health is that piece of, yes, it is global health. And so it's global health wherever you do your work. So figure out where you're passionate and where you can commit and where you can use your skills and your talents and do them there.
Our next question is, are many ways to inspire global health?
Sure. Well, actually, a lot of you guys are sick of me talking because you guys all listen to me talk for an hour. But it's about investing in the local communities, and it's about owning it. Like, think about the things that you get excited about. The things you get excited about are the things that I tell you should be excited about. The things you get excited about are the things that you own. The things that you do, the projects that you take on, when you're in charge of something, you're going to make decisions. It's a lot more interesting to you than if I tell you all the things that you should be doing. And so communities, the way you engage those communities is letting them own it, and taking a step back and letting those communities drive the change that they really want. And you see it in populations that you work with, both in the United States and East Africa. If the community is part of that decision-making process, they're more likely to adopt it than if you tell them how they should be part of that decision-making process.
And I think as a physician, one of the most satisfaction you have in your life, every time you see a patient in your office has a problem and you address the problem and you give a solution and you see the satisfaction in the face of this person. And I think it's the same thing in the community. When you're in love and you have passion for something and you want to transfer that things you have passion with to a community and you see how the community embraces it. And I think that's a very good way of inspiring you. I mean, to say, oh, damn, I'm not alone on this. How many people did you? And that's really puts you and give you so much energy, I mean, to keep working and exploring this community with people. And I'm very happy to hear what my colleague said, and is when you have the integrity in this community, the community just embrace what you're doing, and they keep going and take over with it. And I think that's a very good way of inspiration and what you're doing with passion you have for what you're doing in the community. So always my advice for you guys is one of the highest or hardest part of this work is integrity. I mean, stick with your passion, with your vision, but at the same time, make people that you share this vision with be part of it and take decision in that vision. And I think it's the very best way to inspire yourself and your community.
I share your experience. For me, I think that what have been really very important bring about change is the way that you behave with other people. I think that to bring about change or what I've experienced is not only to do things with people, I mean for people, but to also be with them or do things with them. This is very important. Coming from Africa, from Burkina Faso, Cote d'Ivoire, I really want to stress that. Usually we have many people who come from abroad or NGOs who come to do things for us, but we don't really share our lives. So I think it's very important to bring about change. We have to be with people. We have to do things for them, not with them. And this is a way to strengthen the importance of community. We have to have a kind of ownership. We have to share your vision, and so that they can also embody it. If not, we'll never be able to bring sustainable change. My experience.
I'm still a work in progress. There are days I feel like I'm too old to be a work in progress, but might as well be a work in progress until you die is what I finally decided. So I found a passion for medical education kind of after 20 years of private practice. I never really have a passion for academics and medical education, but I was in private practice. So the opportunity to get back into academic medicine has been relatively recent, about 2000. So I have only been at Creighton for a year, and I'm very passionate about global health. And what I feel like, I don't know how this is going to unfold in my current position. I do know that the best days that I have are when I have a student who's passionate about global health, and we talk about what is possible, not just for the student, but also for me and also for Creighton. So to me, that's my little microcosm community is in medical education. It's a work in progress for how we can maybe bring some impact. I think the issues that we're talking about is not doing for people, but working with people is critically important. I think what Steve has done at Kenya Relief that attracts me so much is that it's a sustainable model. I don't think he said it this morning in his keynote, but their clinic, the clinic at Kenya Relief, is staffed all year. I think Ryan asked me that question afterwards, or somebody did, but so this is really important. These are lessons that we need to learn and share in our learning community, I guess is what I'm saying. The importance of having a clinic staffed all year so that there is care available for patients before and after the teams kind of drop in. I mean, I think that's critically important for us to be aware of in terms of global initiatives. So we'll see what happens.
Everything they said is true. I think listening is very important. At the table, or what they have to say. A lot of times, we learned how to do things. We're so highly specialized. We feel like we can go into the country and tell them how to do things, when that's not the case at all. You're not responsible for that. They have to be part of that solution, and there's a lot of different ways to do it. Every time we go, have an endocrine surgeon come, specialist in taking out goiters, but when they go work alongside a doctor, they learn from them. So there's a healthy exchange of information, listening to people. I think being an example is very important. Go in and be humble. Like we recognize, it's really a case of humanity. It's not, tribal would be one word. You can choose Democrat or Republican. It's not. It's the human dilemma of people getting along together. And I think when you go into a work like this, you have to go with. We're a Christian group. I move almost more away from that, because sectarian is really how you bring people together. You set aside your differences, to agree that you focus on important things, common things. So setting that kind of example, I think, unites people. And so in Kenya, it's a battle to pull tribes together, but we've taken a stand on that. We do it by example. We bring people from all different backgrounds with us that we don't have much in common except we want to touch someone's life. I think we demonstrate that, and I think that's behavior.
Another thing I would like to add this comment, and I think it's very interesting to see how we're on the same boat. I mean, talking the same language. And just to remember that, I mean, based on my experience in Central America, in Africa, and now experience that I'm doing in Haiti, remember that the concept that you apply or implementing in Africa is not going to work in Central America. And it's the same context. And you have to be very careful about people culture, where people are coming from, because and that's something that's very important, because the project that you're going to bring in the community, remember, you're going to work with most vulnerable, very low education. Not even think 1 second this person that you're going to work with would be able to come to join you, but you have to make the sacrifice to train them. That's mean. So project needs to be adapted with people you're going to work with, not people adapted to the project. That's very important. And if you don't do that, if you refuse to do that, you're gonna spend time, you're gonna spend money, billions of dollars. And this is exactly what we're seeing right now. So NGOs come with millions of dollars. But the fact that, oh, we come from Creighton University, I come from Charité University in Germany, so I am an expert. I have knowledge to change things. And I think you fail because it's a win-win partnership between your knowledge and the community environment. So you have to involve people in what you're going to do in the community. So you have to make them part of it. Give them voice to decide what they want for themselves and the community. Ever. So my advice for you, first of all, listen, and then talk. If you get to the community and you talk, and you never listen, I'm telling you, you're going to spend years and years, you're going to be able to do anything. But you have to listen from people, listen what they need, because they know their own needs better than you. You just can advise them, encourage them the best way they can do it. But you cannot do things with them. This is
I was telling the group, when I was at Creighton, I was going to be a surgeon. Again, like I said, I would have been a horrible surgeon. Leave the door open a crack. When I was 22 years old, I left here. I was very convinced that I was going to go to medical school and do all the things I was going to do. When I was 22, I didn't say, oh, when I'm 43, I'm going to be the chief of staff for a governor, and I'm going to be running a research institute in East Africa. You find those things as you go along, and so leave that door open a crack and follow your passions and follow your hearts and find out the things that you're really good at and the ways that you connect with folks. I didn't realize when I was 22 that one of the things that I could do really well is I could convince a really addicted kid on the streets to come in and get services. And so find those things that you're really good at, your passions that drive you. And then let that guide your career a little bit. I look at people who got so rooted in what they're going to do so early on that they didn't open that door for opportunities that would actually develop over time, that would actually tap into and play to their talents. So find what your passions on. It goes into the little thing around the global piece. If you're, wherever your skills and your passions guide you, follow them there and let that drive you.
I read a scripture yesterday, Testament, about God holds hands. Watch it. It's talking about an arrow and how He holds the arrow, shadow of His hand. And I thought about all the young people that were. The illustration was that He put that arrow, that polished arrow, in His quiver, keeps it by His side until He can take it out. And I started to bring a quiver and show you that illustration because at the right time, God's going to shoot that arrow at the target. You guys are all arrows polished. I think the problem, most young people go to a lot of mission conferences. The focus is, make a decision that you're going to follow through with your wishes, desires, and your passions. Because you get married, job, and maybe you don't do what you wanted to do. So, let God polish you, but also, those little efforts, stay connected, make a commitment that your life is part of your life. Hell or high water, you're going to do that. Otherwise, you get like me, you're stuck in the American dream. You don't. If I had never went to Kenya, I would have what I was doing. So, stay involved.
This is very, sorry, just a second. This is very interesting to see that in 2015, I offer a service, a program that we call Global Social Medicine. Reason that I offer this program to the med student from the developed country, I really want them to leave their comfort zone and go in a country like my country and to see how things are so different from where they come from. So I have about 300 med student American coming every year in this program. And what they have to do when they get there is they have to go to each community and do their own assessment by themselves and identify problem, meet people, and discuss to people, and find out what's going on, what the basic needs this community facing with, and come up with solutions. And now most of the universities send us kids to Haiti, so I help them put a project together after assessment, and the university support this project, and they have to come back and implement the project by themselves and the community. And it's incredible to see how the life change completely after this practice. I mean, just going in a community and seeing someone, for example, as I used to say, I think yesterday I mentioned that in my lecture. Again, the problem of global health or the primary care is not going to solve in the hospital. It's going to serve in the community. And unfortunately, we were trained to treat diseases, but we are not trained as physicians to treat the problem. And I think these efforts we need to focus on and see another way of education we provide to the young boys and girls in this generation now. Because I think maybe 5-10 years, I'm going to leave, and all of us, and the responsibility will be on your shoulder. So how you seeing yourself sitting here today in this room, and there's change we're talking for the next 10, 20, 25 years. How are you seeing yourself? How are you seeing your involvement in it? And how are you going to do that? How are you going to be involved in this change? And I think that's a great opportunity today. I mean, you have opportunity to talk. Maybe we are not the most appropriate person to give you advice, because I think there are people more bright, more intelligent, and more experienced than we have. But at least the little experience that we've been witnesses with, and I think we have maybe some arguments, some little tools we can share with you. And I think it's a great opportunity because, again, for me, it's the most amazing science, the global health. I mean, to make this change we are all looking for. But remember, the change has to start by you first. If you cannot change yourself, not even dream you're going to make any change. This has to start by you first. How you seeing yourself in this movement, and how you can get involved. Thank you.
Just want to say something about people who are working on mental health issues area. I think it's very important for you to take seriously the ethical standards of your job, especially when you work in countries, continent like Africa. Most of the countries, we don't have institutions that are able to monitor, help you to respect them. So sometimes you are on your own. It's very important. I will share a quick story. In 1995, I was just finishing high school, going to college. I went for immunization, and I was surprised that they asking me to come every day to take a pill. And after less than 2 weeks, there was a young nurse that came from the Netherlands to work at the small clinic where I used to go to get my pills. And she asked me not to come again. If they call you, don't come. I was surprised. And later, I heard that, this clinic, people who were working in the clinic were testing or, making clinical trials for new drugs. And we were not aware. I did not say anything about that. I just came. They told me that the immunization was free. So I was very happy to go there. And then they told me, since I'm young, we need to do this. And many people, there are villages where many people that come and doing things that are not really required. And with the corruptions, with the authorities, there is nobody. We don't know. Even the media don't talk a lot about these kind of issues. This lady, we just graduated from her nursing school. She was really disappointed. She's the one who said that, no, this was not normal. And she was fired, but because she spoke the media from a country were able to publish an article. That's why they stopped things in our village. You see, so this is very important for people working in global health, because, as you know, I'm teaching international relations, political science. Could see that many, maybe who are studying pharmacy, there are many and more drug trial, clinical trials that are going on in Africa. People are relocating, bringing things in Africa, but we don't have, countries don't have the means to really monitor seriously, effectively, kind of things. And so for young people, I really want to insist that your integrity is very important for us. Yeah. Yes, we need your charity, but we need you to be honest with us. This is very important. Don't afraid to lose your job because the company that hire you want you to do this. So this is very important to me. I never know for what I was. I can test for, so.
I think one thing to keep in mind is during going on a trip is some things that I learned on my trip is I met an oral maxillofacial surgeon. And he was thrilled with the support structure of the experience at Imagori at Kenya Relief. He had been on several other mission trips to, I believe, Nigeria, I'm not sure. But, and I don't know what the organization was, but they were kind of dropped into the middle of a very rural area with tents and minimal boxes of equipment. So they spent the first 2 days of their trip setting up this temporary clinic, and then they'd work really hard for 4 or 5 days, and then they'd spend the next 2 days tearing down the clinic. And so I think it's good to be aware that there are a lot of different situations that you can get into that are considered giving trips, and contrast that to my trip to Magori. And I was thinking here about if you go on a trip, be open to receiving gifts, and I don't mean material gifts. When we our program at Magori is very structured. It surprised me. Like, okay, unload your bags and then meet us in the common area, and so we went to the common area, and the orphanage had done a welcome reception for us. The children at all ages, they came and they danced, and they played the most beautiful music, as the welcome for the team. And I didn't expect that, but that was such a big gift. And then they're like, okay, go back. You've got an hour of time where you might have internet access, and then go to bed because we're getting up at breakfast is at 6, and then we're going to church. So actually, for me, I really like that kind of structure, and we went to a Catholic church service on Palm Sunday in Magori. It was the most beautiful service I've ever been to in my life. And I don't know how to explain why it was so beautiful. It was outdoors. There were hundreds of people sitting up on the hillside, and the church service took place under an awning or a tent, like. But the music, I am in love with Kenyan music, and that is something that I did not expect either. So there are gifts. There are major gifts that you get if you are open to them. And sure, you bring your little bitty talent, your one little area to the mix. But there are so many gifts when you are in an environment like that that stay with you a long time. The other thing I might say is just a self-awareness thing is here in the States, I'm like, and I'm a surgeon, and there's this new hand scrub called Avogard. And I tried it once, and I'm like, I don't like Avogard. It's sticky. I'm not going to use that. You kind of, no, that's not good enough for me. So in Magori, that's all you have is Avogard. I love Avogard now. Avogard is perfect. Sticky or not, it works just fine. So those are things that you learn about yourself when you are out on these trips that are amazing gifts that you come home with. Not hearing. I think HIPAA does apply. I don't know if anybody else wants to answer that. I mean, at the clinic in Magori, everything is handled in terms of the paper trail of a patient being admitted, and it's not online yet, right? But it's paper charts, and they're handled confidentially, and yeah, that's kind of a universal thing. And there's no need to get sloppy with that.
For me, with our one with me. My question is about cultural, and we talked a lot about text, the local culture. Faced some negative challenges while we were there with positive experiences. So it's not right. You're certainly out and time or a little bit quickly. It might help, but it depends work, and there's, I think, a lot of involved when people and work with women. I they would by their own cost. So just professionals who live longer countries. How do you go cultural 60 times a day on the street? So like, have you experienced something like this? How I did it? So Did I bring the point clearly?
At Magori, we're a little bit isolated because we are in a fenced compound and there are guards. And that's a little bit of a sadness because I'd like to be more integrated in. But I think for short trips where you are just kind of coming in, doing an intense amount of work, it's okay. And our host missionary couple, Devery Coughlin, part of our structured agenda, she took us out into the community and did a community home visit of one of the orphans' grandmothers. And that was a very amazing experience. So I think we lose something by not like walking through the marketplace that we were told we could and should not do that. Unless you're going to be there for a longer stay. So I think I don't know that there's a perfect answer. I feel like I had a really good experience with our home visit. We visited two orphans in the orphanage. We visited their grandmother. The grandmother had lost 3 children from a motorcycle accident. And they had 9 grandchildren she was trying to. So 2 of them were brought into the orphanage. They had in Magori, there were small homes which were 3-sided with no doors, no windows, with mud and mostly metal roofs, no running water, no electricity, and they were built in a U-shaped around fire pit, the common cooking area for that community. And the grandmother was very excited. She was crippled; she can't walk. But she was very excited that the government was building a latrine. Like that week or the next week, they were going to get a latrine. I think there is, how much you can actually immerse yourself in the community when you come in for a short period of time. I think you have to have realistic expectations. The fact that our host family took us into the community in it was kind of Devery made sure that we were respectful and that it was an okay environment, but we were able to. That was very impactful.
I do. I embrace them. I'm a very good Mzungu. I spend about 3 or 4 months a year in Africa, and the more you can have fun with it too. I mean, you are. Somebody said getting out of your comfort zone. It's brilliant. Like that's the other piece of it. Get out of you're out of your comfort zone. You're out of people where you're now the minority, and have fun with it and engage folks and ask them questions. And the more you can engage in that discourse where you get to know one another, you learn a lot from those experiences. And there's the discomforts that actually lead them. So I'm an avid runner, so I love running around the slums of Kampala, and I'll go hang out. And they want to, actually, if you're a white person running in Kampala, they're curious what you're running from and what's going on. And they're like, oh my God, are you okay? And it's like, I'm fine. I'm a Mzungu. And you're like, well, you're a Mzungu. Like, no, I'm not a Mzungu. And the more you can engage that conversation, they're fun conversations now, but they're going to push us out of our comfort zone. And you learn from those conversations. And a village that we go to a lot, when you go through it, all the kids will come up to it. They're like, give me money. Well, what we found out, it was fascinating because I started asking them for money. And they asked me for money. I was like, well, you give me money. And they're like, I don't know what you're talking about. And it was great. They don't know what they're talking about. They're not asking for money. They were taught to say that. They don't even know what that means. If we gave them money, they would be like, oh my God, why are you doing that? And so in embracing that storytelling piece, these folks have great stories at the table. And having fun with it and being okay and getting out of your comfort zone. And you are awkward. You're the person who you're coming into a different culture. And it's so good for you to experience it. When you come back here, you understand how that African person who's visiting here feels when they're in a room full of folks who don't look like or have the culture that they do. And it's so healthy because it makes you more self-aware and it makes you more humble.
I think I absolutely and a lot of, you first one, second, third, and 10 times a day, try to bring your child out of here, and sometimes, and last thing, when we talk about it, a lot, when people work countries, call it like charity. Not forget that it's the work in a lot from this work, that it's not just charity. I think we professionals remain from
There's one thing I want to add. First question, and I'm so glad that I'm seeing so many faces here to come down to my seat in this room. The first thing, and I think every foreigner was visiting a third country, you just can't just book your ticket and jump there. You have to get a reference where you're going, someone who can guide you and work, introduce you. And there's another thing that you have to really pay attention about. If you go visit a local organization, for example, if you go into Osaka, and I'm so happy I have witnesses here, people who used to come to my clinic in Haiti. I'm working in a community with 72,000 people. It's a very big community. I don't have any one policeman in this community. And I don't have any security guard on the compound. It's people sleeping, door open, windows open, it's wide open. The first thing you have to pay attention when you visit a local organization, if the owner of this local organization restricts you to go to the community, talk to people in the community, something wrong. Because if you're doing a good job in the community, you're supposed to be welcome. And people will embrace you. Because most of the time, if I receive money to do something in the community, and that money never been spent in the community, and people in the community keep seeing people coming, and nothing never done in this community, people get angry. And that's why most of the time, the owner of the local organization, they restrict people, visitors, to go. You've been in Haiti, right? I never told you don't go anywhere to work in the community. You're playing with kids, you're visiting projects, you go to school, you visit people, and you talk with people. And because it's important to have the feedback of citizens you visited in the community about the local organization working in the community. And most of the time, the owner of this organization is afraid that you get feedback from people because they're not doing something right. And I think I'm agree with you. So when you get in the community, just involve. Make you like, you are no longer in the United States. You are completely out of your comfort zone. So try to be familiarize yourself and the people in the community. And about the culture, for example, in my culture, I'm talking about Haiti. The Haitian people is the first black free nation. The Haitian people hate people donate or give things to them. It's a question of paradox. The fact that we are the first black nation free from slavery. And we hate when people come and humiliate us, charity. But we are a very good host. We enjoy having people and working with people. And we enjoy sharing with people. But sometimes there is so much arrogance when people coming outside, they bring gifts, as you said, get to the community and people say, Blanc, give me $1. So you're going to hear that 24/7. But they don't even know what they said. Give me $1. But they know how to say that. And I think it's you have, what I said at the beginning is, when you get in a community, you have to take time to listen. Listen to people, learn from people, and then you act. But most of the time, we act before we listen. And this is where the shock, cultural shock, come in. And this is where things turn badly. So this is
much. Okay. All right. Oh, 24. Wrong fight.
Uh,
When did you get sick?
uh, no, my child had chickenpox.
I
My
never really get sick there either.
husband had, yeah, he ate something wrong. But we ate out. Had advice, I'll never eat out. But you're like, okay, there are only cans and cans put in the grocery store, and I cannot eat avocados, mangoes, and although I loved it. But my husband, so we ate out, but we went to like.
Get sick in Haiti?
No, but
So did you get sick? Oh, all right.
But I gotta say, I think it's great. I think it's such a good conversation. I did my Fulbright for a year. I lived for 6 weeks in the poorest part of Uganda, and I think your comment, you have to be very, when you travel, please be careful, drink good water. I lived in the poorest part of Uganda for 6 weeks, and I ate with the local people, and we ate beans and rice. It was great. I spent 6 weeks there. I went home because I was so excited to be home because I'd been living in a slum. And I was so excited to be home. And the first night I got home, I ate at Solera. It's this really fancy steak restaurant. I had a $50 steak because I was home and I'd conquered the universe. I had food poisoning that night. So it was the worst food poisoning I ever had. So my message is, yes, be careful. Please be safe. But don't miss that opportunity to experience the local culture. And yet, don't eat bad food and pay attention. And safety and security is important. But don't make that compromise your experience of getting to know the culture and trying the experiences there.